With the increased demand for plastic or aesthetic procedures and aesthetic surgery, everybody wants to look younger, everyone's living longer, everyone's working longer. There's a lot of confusion about what actually is a plastic surgeon, or what is plastic surgery or cosmetic surgery or aesthetic procedures. And I think this is very important because the public needs to understand the definitions, because safety is a concern, as are results. There's also a great amount of confusion as to how do you go about selecting a properly trained professional or physician for a cosmetic procedure. And studies show that most people don't know how to go about that because there's very confusing marketing with the internet, and credentials are at issue. So the studies also show that the #1 factor in obtaining a safe and satisfactory result in aesthetic or plastic surgery is the training, qualifications, and experience of the physician or the provider. Because of the high demand for cosmetic or aesthetic procedures, it's important the public understands the difference between a board-certified plastic surgeon and a board-certified cosmetic surgeon. There is no board of cosmetic surgery recognized by the American Specialty Boards, which is the only body that identifies the various specialties in medicine. In order to be a plastic surgeon board certified, the doctor has to complete at least 6 years of training in surgery, and especially of plastic surgery, part of which is cosmetic surgery. The Cosmetic Surgery Board only requires 1 year of training, and that's open to any physician who fits that criteria. So that is not recognized by the American Specialty Board, so there's really no such thing as a board-certified cosmetic surgeon that's qualified by the American Board, which is the only accrediting agency. The public is also surprised to find out that there really isn't any supervision or regulation of marketing claims made in cosmetic or in aesthetics. This refers to both surgery as well as services and products. So anybody can make a claim about what a product does or what a procedure does, but often that claim is not justified by any research-proven study, and that's very important for safety. So often marketing misleads the patient into making non-informed decisions, and that can be very problematic. Well, this isn't really a turf battle with patients. This is more about having safety and qualified training so that an aesthetic procedure, cosmetic surgery, can be done safely. And the public needs to be more informed. Marketing is confusing, the internet can lead to confusion, and the public is often surprised to find out that any doctor, any MD doctor, can perform a cosmetic procedure in their office, even though they never trained in that specialty. So sometimes you'll have emergency room physicians, radiologists, and other specialties doing cosmetic surgery, even though they didn't train in residency and get approved credentials for doing that. So I think it's very important to do your homework when you look at these procedures and understand these are serious procedures. They can't be learned in a weekend course, and that the public needs to understand what's regulated and what's not, so they can get an outcome that's going to be safe and effective.